from soil
Feeling like I was dying was like the worst part of it.
to lungs.
In the time I was in hospice, I couldn't walk for 10 months because it was in my bones. The valley fever got to my bones, so I was in a wheelchair for 10 months as well. And then I had to go to physical therapy to learn how to walk again.
To your entire body, patients like 21-year-old Ashley VAS knows what it's like to live with valley fever.
Oh, it makes me look at life completely different because, you know, I would have never thought that I would have this disease, that I would have to like go to treatment every week or like take pills for the rest of my life.
After 2 misdiagnoses, VAS, who was pregnant at the time, was forced into labor early when her body was not responding to antibiotic treatment for ongoing fevers, seizures, and headaches.
Instantly, they're just like, we have to get the baby out of her. So they could start like giving me treatments and medications and stuff so that it wouldn't affect the baby. So I got induced 2 days later. I had her natural and everything went good, but at that time my mom did have to sign a consent saying that me or my daughter weren't going to make it. We weren't originally both supposed to make it. It was either or, and we both did.
And after today,
congratulations. Thank you.
Patients like VAS will receive further support after Kern Health Systems' $100,000 check donation to Kern Medical for valley fever education, research, patient care, and awareness.
Allows us to care for our patients in the usual fashion. We're trying to up our game in terms of the public understanding this disease better so that they get diagnosed more early. We're trying to improve the knowledge of the professional community about the disease so the disease is diagnosed and cared for more appropriately.
Director of Kern Medical Valley Fever Institute, Royce Johnson, says over the past 5 years he has seen the number of cases increase across the state and that Kern County is known for having the most cases. According to Kern County Public Health, in 2013 there were 201 cases, and just last year there were 325 cases. And Johnson hopes that by educating the community with the help of the proceeds today, patients and doctors will better understand the symptomology to detect early signs, even though there is no cure for it as of now.
Presents as a respiratory illness, not unlike influenza or pneumonia, and it's commonly misdiagnosed as what's called community-acquired pneumonia, meaning bacterial disease. The disease is clinically somewhat different. It's a bit more slow in its onset than bacterial pneumonia. But if you have pneumonia and you live where we live, on the differential diagnosis of that illness has to be included valley fever, and everyone, patients and the profession, need to be aware of that and be prepared to analyze the case in that light.
As for VAS, she's just happy her and her family made it and that future patients will have extra support.
It means a lot because the voriconazole, the pill that I'm taking, is what's bringing my numbers for my valley fever down to where I can live a normal life. So it's what's keeping me alive, it's what's keeping me going, it's what's making me better. So that check means a lot. Like, it's just like hope for other people to get better, you know.